My name is Caroline Meir, and I'm going to make a presentation on effectiveness of dialectical behavior therapy in individuals with borderline personality disorder. So, what is borderline personality disorder? The National Institute of Mental Health defines it as a severe mental illness which is characterized by unstable moods and behaviors. The Diagnostic and Statistical Manual for Mental Disorders is used by a mental health care professional to diagnose bipolar personality disorder together with other mental illnesses. However, for a person to be diagnosed with a bipolar personality disorder, uh, an individual must show at least 5 out of 9 symptoms, which an example is recurring of suicidal behavior, stress, or self-harming behavior such as cutting, headbanging, burning, um, which is a healthcare problem. Repetitive suicidal ideation, suicide attempts, or self-harming behavior among individuals with bipolar personality disorder poses a big burden in the healthcare environment. So what effective interventions can help reduce the rate of self-harm or suicidal behaviors among individuals with bipolar personality disorder? So according to PICOT, in individuals with borderline personality disorder, how does the dialectical behavior therapy compared to traditional cognitive behavioral therapy affect the rate of suicide relapse within 1 year of treatment? So to support the healthcare problem, uh, the National Institute of Mental Health reports that as many as 80% of individuals with bipolar personality disorder have suicidal behaviors, and about 4 to 9% commit suicide successfully. Also, research study shows that 69 to 80% of individuals with borderline personality disorder engage in suicidal behaviors. So I was able to review 4 randomized controlled trial research studies, and in all four of them, the participants were randomly selected to the intervention group and control group, and it was found that the dialectical behavioral therapy compared to treatment as usual or traditional cognitive behavioral therapy, it was found that dialectical behavioral therapy was unique in reducing suicide attempts and reducing high-risk behaviors. Also, a study was also carried among adolescents with bipolar personality, borderline personality disorder, and it was found that it helped reduce self-harm behavior, suicidal ideation, and depressive symptoms. This is significant. The dialectical behavioral therapy is significant in nursing practice in that it will help the mental health professional to manage suicidal crisis by identifying situations that evoke suicide ideation and self-harming behaviors. Two, it will help identify the problem and analyze a series of events over time, which can point out the variables that control or influence certain behaviors. Um, it will also help increase patient care outcome by decreasing hospitalization, emergency room visits, increase treatment adherence, and promote safety, and overall decrease self-harming or suicidal behaviors in chronically suicidal individuals with borderline personality disorder. Um, some of the proposed changes in nursing practice is that implementation that the dialectical behavioral therapy should be implemented um, to new patients and adopted in clinical in different in across different clinical settings. The mental health care workers need to be educated on the effectiveness of the electric uh, behavioral therapy and should be trained so that they're skilled enough to be able to apply it in clinical practice. The electrical behavioral therapy is more suitable in outpatient clinical setting because this is where we find about 8 to 11% of patients with bipolar personality disorder. And we can help by addressing this outpatient, we can help to prevent the patients from experiencing suicidal crisis. It will also help them to maintain treatment adherence and therefore enhance normal functioning of daily living. Thank you. Mm.